You know what kept me at Rochester is actually the thing that brought me to Rochester in the first place. It is a terrific community. It's an academic health center. I think as a mid-size university, we're going to play to our strengths, and we have terrific strengths in aging, in HIV and sexual health, in cancer and palliative care, and in maternal child health nursing. And I think building on those strengths is really allowed us to develop more visibility, but also it creates a lot more synergy with research groups, and it creates a lot of cross collaborations. So it is very much a networked university. It provides a lot of opportunity.
The infrastructure that has been developed here in the School of Nursing to conduct research is really, really powerful. I was blown away by the integration with the medical center, which directly facilitates my ability to do research. So no matter whether your research takes place in the community or at the bedside, you have access to the environment that you need to, actually conduct the work that you do. There's very few schools of nursing that have such an infrastructure set up to support investigators at all stages to really successfully compete for research grants and also conduct and lead research.
In our areas of science, people really are looking to both build the skills of the researchers, the next generation of researchers in nursing and health science. I think that's key, but also to be ever better at the work that we do with patients, with families, with communities that we work with.
One of the ways of solving or trying to address health issues is doing research, is understanding the why and understanding how can certain problems be addressed, and asking questions. And are we asking the right questions? And are we addressing this in the right way? This is all about becoming more action-oriented and solving and addressing health issues. And I find that fascinating. I find that exciting.
As we've all had this period of disruption, I think it's given a lot of people an opportunity to think about what works well when working with people with serious illness, with chronic illness, with the potential for illnesses, but what works well to keep people healthy. How do we keep people healthy in their homes? And it's important to see your science from multiple perspectives and to really think deeply about how it can grow and develop and be informed by many of the resources and the expertise that's available here. That's the kind of environment you want, is where people want you to have success. When you have a group of people that you're working with that share a lot of the same content expertise, but are approaching different problems and different phenomena, within that, I think you really can expand your way of thinking about your own program of research moving forward.
The team here is just phenomenal, and it's also very close-knit, warm, loving. It's a community that people really grow together in. So it really was a good place to call home. Everybody's sort of mission driven, so I like to be places where people are in it for the right reasons.